A dental crown is a restoration that cover the entire tooth structure. It will fit over the tooth and it will get cemented on the tooth structure. Crowns are made out of different materials. They can be made out of all ceramic materials, or it can be made out of a porcelain fused to metal, or it can be made out of all metal. Each crown will require a core. That core can be all ceramic or it can be metal, and then a layer of porcelain will build over it. That's the laboratory part. We get the crown back and then we get to cement it over the tooth. In my experience with my patients, crown lasts for a very long time and they look very natural, especially with the advantage of having an in-house ceramist who makes sure that he be able to match the crown with the adjacent color of your teeth. This way it will come up very natural and nobody will be able to tell them apart. The process of making a crown is a two-visit most of the time. The first visit will be to look at the tooth structure, remove any of the old restorations that you have, clean up the tooth, make the impression, placing of a temporary restorations, and then you going home waiting for the crowns to be made in the laboratory, and then you come back on a subsequent visit and the crown will be cemented. The pain will be minimum. You will be comfortable during your first visit, and at the time of delivery you will have no problems with getting the crown done. We prefer to place a crown on a tooth rather than taking the tooth out. In the right circumstances, it is the best treatment of choice. But in certain circumstances, we need to get the tooth out and place an implant in and put a crown on top of the implants. But our preference is try to preserve the tooth for as long as we can. A crown is a restoration that we put on a single tooth. A bridge is two crowns connected together to replace a missing tooth. Although, in my opinion, it's better to place an implant in the missing tooth area versus connecting them with two crowns.